Welcome to Impactful Chats. I'm Malin Martinez,
And I'm Seth Truger.
and today we're chatting with Tricia Pendergrast, a medical student at the Feinberg School of Medicine and co-founder of GetMePPE Chicago, an impact partner. Welcome, Tricia.
Thank you for having me.
So start off by telling us a little bit about Get Me PPE and your role with the group.
I am one of the group's co-founders. Get Me PPE Chicago was founded by a group of medical students that sort of combined efforts back in March. So I was the one that started the PPE collection efforts at my medical school, which is the Northwestern affiliated medical school, Feinberg, and ended up talking with other students at other Chicago medical schools who were doing similar work, either raising money to buy personal protective equipment, trying to make personal protective equipment, or to get donations from the community. And so we thought that the best path moving forward would be to pool our efforts, and essentially took various components of all of our different initiatives and combined them. And that is what Get Me PPE Chicago became. Since we started in late March, we have partnered with many different organizations, Impact included, to either raise money to make PPE ourselves, to raise money to send PPE to other places. And we've successfully donated about 430,000 units of personal protective equipment since we started. And then we also help out other organizations with logistics support. So we just partnered with Med Supply Drive, which is another student-run organization, to fly respirators where they were in Michigan to where they were needed in Texas.
Wow, that's amazing. And so which of the Chicagoland facilities have been benefiting from all this work you're doing?
So the answer to that question would have changed kind of whenever you asked me that. And it's an interesting view as to which populations were being worst affected by COVID in Chicago. So initially, we were really only donating to acute care facilities, places like hospitals only, and hospitals that had ICUs. We were focused on community hospitals predominantly. Very few of our donations ever really went to the academic affiliated hospitals, which is interesting because that's where we're all from. But very early on, we recognized that it's really the community hospitals, those who take a lot of Medicaid patients. Those are the hospitals that are predominantly serving Black and Hispanic Chicagoans. And they had, a lot fewer resources than the academic affiliated hospitals. As the pandemic wore on, even the community hospitals, to a certain degree, were able to get their supply chains stabilized. Sorry. Someone's actually calling me about PPE. That always happens when I'm getting interviewed. And so we were able to see the supply chain stabilize in hospitals. And then we focused our attention on nursing homes. So once we were confident that the hospitals were in, an okay place, everyone had an N95 and needed one, we started reaching out to nursing homes predominantly on the south and west sides of Chicago. These places were only relying on essentially the government for personal protective equipment. They were given what was meant to be a month's supply, and it was not a month's supply. So they were asking for everything from, respirator masks to disinfectant to hand sanitizer to gowns. One person called us and asked us if we had food because her entire dietary staff was out sick. That was back in May. And so we have seen a little bit of stabilization for nursing homes, and are now sort of splitting our focus between community organizations and nursing homes. So partnering with, organizations that provide care to people experiencing homelessness, partnering with groups that do anti-poverty and food insecurity work to make sure that we can get PPE out into the community where appropriate, but also make sure that the people doing that essential work are not going to be put into harm's way as they're working with these vulnerable populations.
And how does your group find out which facilities need PPE, and how is Chicago doing as a whole?
So we, from the very beginning, have had a somewhat unique approach to that process. As opposed to waiting for groups to contact us, we designed a proactive calling strategy for the healthcare organizations we were trying to reach. So we decided a priori where we wanted to target in terms of geographic areas, and started with the highest acuity at the beginning of the pandemic, and just called and tried to get in contact with supply chain coordinators and people who'd be able to get personal protective equipment into hospitals. Something we were really worried about that some other organizations do is providing donations to healthcare professionals. The healthcare professionals bring the PPE into work and they get fired. And we wouldn't want to be in a position where someone would get disciplined because we, gave them personal protective equipment. So we focused on community hospitals first, and then we called all the nursing homes on the south side. We called all the nursing homes on the west side. And then now we're kind of making our way sort of back up to the north side as well. But all of those decisions were informed by our knowledge and research about sort of demographics of inequity, but also what we understand to be the historic disproportionate disinvestment in predominantly Black and Latino communities in Chicago, and really being aware of that, understanding that facilities that operate in those locations, they're going to be the ones that are going to be hardest hit because they're the worst resourced. So that's where we really targeted. And we also understood that, not everyone in the community will have heard of us. The work should really be done by us because, healthcare workers are so overburdened right now. To contact whomever and be like, hey, we're here, this is what we have to offer, tell us how we can help. So I think they're pretty overwhelmed right now.
Yeah, that's a really, really smart strategy. So places didn't have to at any point reach out to you guys to request PPE.
They didn't have to, many did, especially with nursing homes. There was a lot of, my colleague at X, Y, and Z location, they were just mentioning to me that they're also out of disinfectant. Can I give you, can they give you a call? And the answer is always yes. So there was a little bit of that. We do try to promote that we have these items for donation on social media. And, speaking from experience, I get a lot of emails of people offering me to buy PPE every day. So I think also people are just starting to filter this stuff out, and we just want to make it as easy for people as possible.
I see. So can you just tell everyone how they can volunteer or where to donate?
Sure. So we have many different volunteer roles. For example, a group of people who really love running got together and they're planning a virtual run. So if you want to help out, there's really no limit to, if you have a good idea, we're not going to turn you away. We're successful because we really sort of capitalized on the creativity of a lot of very different people who were passionate about different things. We have a group that's working on like designing art and then selling it, and then the proceeds will go to our organization. So if you're a runner or an artist, I'm neither, you can get involved that way. We also need delivery drivers. So if you have a mode of transportation, we have a couple motorcyclists that help us out, and you want to deliver personal protective equipment. And if you're a sewist and you can sew and create, we would love to have you help us make masks. And all of these different opportunities, including just spreading the word, which we love. Various organizations are looking to donate money, but also sometimes people are just, looking to donate time, and we love both. We need both. You can either email us at GetMePPEChicago@gmail.com, or follow us on Twitter at GetMePPEShy. And we also have a website, GetMePPEShy.com. And you can also just Google Get Me PPE Chicago and we pop up. I tried that the other day and it does work, which I was very excited about. So all of those ways are great. And then we're also on the Impact website. So if anyone is familiar with Impact, you can link to us there as well.
Great. Well, I'm always impressed with this great work. Really appreciate what you're doing. And thank you for joining us on Impactful Chats.
Thank you for having me.